Alors, bon après-midi tout le monde. Good afternoon, everyone. Welcome to this webinar. On vous souhaite vraiment la bienvenue à ce webinaire. So someone sent me an email last week saying it would be time for a webinar. There are so many things going on with the pandemic. So are you planning a webinar? We were actually planning a webinar for today, and everyone is very glad to be here and to be able to provide you with some much needed information during this sixth wave. Alors, aujourd'hui, on va avoir une présentation assez extensive de la part du Dr. Charles Poinet sur ce qui se passe durant cette sixième vague de la pandémie. Et ce sont des informations qui sont importantes à partager avec vous. I would like to thank everyone once again for everything you're doing for our patients, for their families, and I know it's been a long time. It's now over a bit over 2 years during this pandemic, and because it started in mid-March of 2020, and we've been doing very good work up to now at the MUHC. On a été vraiment des joueurs très, très importants dans la réponse à cette pandémie. Donc, je vous encourage tous à mettre encore une fois l'épaule à la roue pour quelques semaines, quelques mois. Dr. Frenette va nous en parler un petit peu plus. So, today, on the agenda, alors si vous voulez me mettre l'ordre du jour. Alors, on va débuter avec la prochaine, s'il vous plaît. The next slide, yeah. Non, une en arrière, s'il vous plaît. Oui, c'est ça, c'est celle-là. Alors, Dr. Frenette, on lui a demandé de faire le point sur la pandémie. Of course, we know that Dr. Frenette is one of the experts at the level of the ministry and one of the people who are helping the government to make decisions by his work on le comité sur le 5, la prévention des infections, et le comité provincial. Alors, on aura une présentation par Charles, toujours intéressante. Secondly, Madame Dubé will be answering the questions and making a presentation on what should you do if you've been exposed to the virus or if you test positive and you work at the MUHC. So how is that going to work? It's a bit complicated, but Caroline will try to explain all of this. Puis Caroline va nous parler par la suite de ce qui se passe avec les primes monétaires qui sont données aux gens qui travaillent durant la pandémie, durant certains secteurs. Puis après ça, on s'est donné quand même du temps pour les questions et les réponses. Je suis certain que vous en aurez beaucoup. So our usual Q&A period, and that will be moderated as usual by our PDGA, Madame Martine Alfonso. Alors, sans plus tarder, je vais donner la parole tout de suite au Dr. Charles Frenette pour sa présentation sur l'évolution de la pandémie COVID-19. C'est à toi, Charles.
Merci bien. Bonjour à tous. Ça fait presque exactement 3 mois qu'on ne s'est pas rencontrés. Alors, beaucoup de choses, beaucoup d'eau qui ont coulé sous les ponts. Première diapo, s'il vous plaît. Suivante. Vous avez manqué le titre. Reculer de 1. Alors, on pensait tous que c'était fini. En fait, on souhaitait que ça soit fini. Et je ne sais pas si vous avez entendu parler, mais BA2 is having a party. Et ça, c'est des photos du spectacle de Justin la semaine dernière. Le Centre Bell pacté et comme vous voyez, pas beaucoup de masques. Suivante. La situation au CUSM, vous voyez les chiffres ce matin, 23 patients, 6 aux soins intensifs. En fait, c'est même rendu 4 aux soins intensifs. Donc, quand même, un nombre de cas gérable. Et j'ai mis en filigrane là, dans le coin à droite la dernière fois qu'on vous a fait un webinaire qui était le 4 janvier, donc 3 mois jour pour jour. On avait 116 patients et 27 aux soins intensifs. Alors, la situation est quand même pas la même qu'il y a 3 mois et quand même, malgré tout, grandement améliorée. ce qui nous permet quand même d'avoir repris la majorité de toutes nos opérations. Diapo suivante. Et ici, vous voyez le nombre d'hospitalisations et au cas où vous n'étiez pas convaincu, il y a en effet une 6e vague. Et vous voyez que le nombre d'hospitalisations la semaine dernière a atteint un pic à 34. Et le seul espoir peut-être dans cette petite diapo-là, c'est la petite ligne grise en bas, où vous pouvez voir que le nombre de cas aux soins intensifs reste quand même relativement faible, autour de 5-6 présentement. Alors, les nouveaux cas qui sont admis vont un peu moins aux soins intensifs. Diapo suivante. Alors, what's different with BA2? Well, this is, I could tape myself from the last meeting. It's more contagious again. We're talking about a reproductive number of 8 to 12, which basically means that one case seems to infect up to 10 persons. You can see on the left a diagram of the evolving nature of the virus, and you can see that there's a few common mutations with Omicron BA1 in light blue, but on the binding site, there are 4 new mutations on the spike protein in dark blue that make it relatively different from BA1. Something that has come out just lately, it looks like the peak of the viral shedding in the upper respiratory tract is a little later with BA2 compared to the previous strains. And it looks like a couple of papers that I read this weekend, it looks like it peaks around day 4 to 5. Even though the incubation period seems to be shorter than the alpha and beta strain, the peak of the virus seems to be a little bit later, which explains quite a frequent phenomenon that we've been observing is people testing with antigenic tests on day 1, day 2, and they're negative, and they only become positive on day 4 or day 5. And that's probably a function of the viral load. As you know, the antigenic test is not as sensitive as the PCR test. Thirdly, the severity, well, it looks very similar to Omicron, i.e. less severe than Delta. As for BA1, it looks like there are less ICU required per case and to have a mortality that overall seems lower. I remind you that in the previous pre-Omicron, we had mortalities of up to 10%. And it looks like with Omicron, mortality seems to be below 1%. A little curve with this change in the configuration of the spike protein is one of the major treatment we have at the MUHC. The antibodies, so sotrovimab, may not be effective against BA2. And as well, we have seen a few cases of reinfections, and immunity from a BA1 infection may only be partial against BA2. Some estimates are 90%, some estimate are 60%, but one of the belief is the further away you go from your original BA1 infection, the less immune you will become with time. And finally, but that's a very local observation, certainly in healthcare worker, the proportion of symptomatic healthcare workers seems to be higher than with the BA1, at least in those that come for testing. Next slide. So the real problem for us with BA2 is the number of healthcare worker it's been affecting. And you can see here the number per week. And you can see that we're actually in our 3rd week of the 6th wave. And last week, we had close to 300 healthcare workers sick with COVID, which, you know, comes to about 56, sometimes 60 a day. And just with the 6th wave, we've had over 500 healthcare workers sick with mostly BA2. Next slide. This is the daily number of positives. As you can see, we peaked last week, last Thursday, with 60 healthcare workers. And that really, really affects our operations that we're trying to fully maintain. Next slide. Most, if not the majority of cases are acquired in the community. A very strong proportion of these are direct familial contact. A few cases we can link to patients, very few, and a few cases we can link to healthcare workers. Next slide. A few difference from the previous waves. The sixth wave seems to disproportionately affect physicians. I think this is probably the wave where I've seen the most doctors being affected. That includes specialists, generalists, and residents. A lot of residents have been sick in all our missions. As well, we've had over 50 students, medical students sick, and this is really out of proportion to what we've had before. You have the residents here. And finally, but not least, a lot of administrative agents. In fact, one of our current outbreak has been amongst administrative agents. Next slide. In terms of site, even though the most frequent site is the Glen, the site that seems to be disproportionately affected this time around is the children. And as much as they've been protected in the previous wave, you can see the number of healthcare workers at the children is just as many as the number of healthcare workers at the MGH, even though the MGH is a much bigger site where healthcare workers are working. Next slide. Just this morning, we had almost 300 healthcare workers at home because they were sick with COVID in the last 10 days. We had 130 who were in quarantine for familial exposure. And just at 8 this morning, we had 28 new positive. Altogether, almost 450 healthcare workers absent for work just today. Next slide. Why? Obviously, the relaxing of the measures is a great part of this. When all the provinces, the ministry decided to relax their measures a few weeks ago, they didn't expect BA2 to come in at the same time. At the same time, we're experiencing high levels of pandemic fatigue. We're tired of the mask, we're tired of being isolated, and we're really relaxing our attitude. And yes, granted, for the majority of healthcare workers, the disease is benign. It's really for our patients that it's not. As I mentioned, the biggest source are familial exposures, children, but we are starting to see healthcare worker to healthcare worker, especially, for example, in medical students. Next slide. I spoke to you about Quebec, about the MUHC in Quebec. So this sixth wave in hospitalization is being observed as well, as you can see over here. And this is the number of admissions in light blue and discharge daily for the last 14 weeks. And you can see that for the last 2 weeks, there's an increased number of hospitalizations, between 100 and 150 new admissions throughout the province every day. And discharge being relatively constant. So right now we are up to about 1,300 cases being admitted in Quebec's hospital. Next slide. This is admissions according to vaccination status. You can see that either unvaccinated or partially vaccinated make up about 40% of cases. But about half of cases are fully vaccinated individuals. Here at the MUHC, again, immunocompromised patients, transplant patients, oncology patients that have not mounted a good immunity to vaccine. Next slide. ICU, you can see that much less cases up to now than in the fifth wave, but a slight increase throughout the province in the number of admissions, but still anywhere between 5 to 10 admissions a day in all of Quebec ICU. Next slide. The big difference in the sixth wave in Quebec is there are some regions that are really disproportionately affected. All of Eastern Quebec, Bas-Saint-Laurent, Gaspésie, Île-la-Madeleine, Saguenay, Abitibi, Témiscamingue, their hospitals are full, overcapacity, COVID. They're not big hospitals. Sometimes here in Île-la-Madeleine, you know, it's only a 40-bed hospital, but it's completely full with COVID. So big challenge for all of the Eastern Province. This extends to Newfoundland, which has their highest rate since the beginning of the pandemic, Northwest Territories, a little bit all the peripheral areas which had not been hit yet too hard with COVID. Next slide. Now, are you protected? So the ministry came up with new definitions, which they call immune, partially protected, or not protected. Immune is if you've had 3 doses of vaccine, you've had COVID since December 20th, i.e. with Omicron, even though the immunity for BA2 may only be close to 80%, we don't know yet. Generally speaking, if you're immune, you do not need quarantines if exposed. On the other hand, if you're completely unvaccinated, if you've had COVID for over 6 months and you haven't been vaccinated since, you are considered non-protected. And in this case, the quarantine rules that we had before still apply, i.e. the 10 days quarantine if you're exposed, because you have a higher chance of converting, of having a high viral load and being very contagious. Most of what I'm going to tell you in the next few slides apply to the partially protected, which I'm going to detail further. Next slide. So what's new for the quarantines? Well, if you have COVID, ideally, still, the quarantine is 10 days from onset of symptoms. If you have improved at day 7, and if you're asymptomatic for 48 hours, you may return at day 7 with negative antigenic tests. So you remember, I must have told you 20 times that antigenic tests are no good for diagnosis, but they seem to correlate better with infectivity. So that to counteract the healthcare worker shortage that we have, the ministry has developed this new algorithm that if you are asymptomatic and you have negative antigenic tests on day 5 and day 6, you may return on day 7. And this will apply to all our COVID positive patients, unless, of course, you're immunocompromised. If we're still in breach of service, you may return at day 5 if asymptomatic with negative antigen test as well. So this is for the COVID positive healthcare worker. So we at least have an opportunity to gain 3 days. Next slide. For the exposed healthcare worker, and obviously no symptoms, because if you have any symptoms of respiratory tract infection, whether it's COVID or another virus, you should not be working. What's new, if it's a punctual exposure, for example, you were at Justin Bieber's concert, you don't need to quarantine. If you were in a restaurant with someone who was COVID positive in front of you, you don't need to quarantine. We will advise that you get tested every 2-3 days while you work, but you do not need to quarantine for single punctual limited exposures. If you have a familial exposure, your spouse is positive, but you can kick your spouse out of the house or kick yourself out of the house and quarantine. Then you stay off work until you test yourself. And if you're test negative, you may work. And we advise that you daily test yourself until day 10, or at least that you test every day you work to make sure that you don't come in contagious. The third situation is you have a continuous familial exposure. At this time, it's your kids in school. You cannot segregate or quarantine from your kid. Then you may return day 8, so it's only a 7-day quarantine from the last contact. But again, we ask you that you test on day 7, 8, 9, and 10 to make sure that you don't come to work. And this test is a PCR test. If there's a breach of service in your service, again, return day 7, return day 5 with negative tests, day 6 to 10. And if you're really in a breach of service, you may come back daily with daily negative tests. Lastly, but not least, if you're positive, we may send you to take care of COVID positive patients, but we have not had to do this as of yet. Next slide. This is some MUHC data, and we look at all our exposures of healthcare workers who had positive contacts in their family. And when did they become positive from when the case was diagnosed at home? And you can see that the most frequent day after diagnosis that healthcare worker become positive is day 5 and day 6. And I think this is with Omicron, and I think it illustrates the phenomenon that I tell you that the peak viral load is a little bit later than what we've seen with the previous viruses. Up to day 7, 90% of familial contacts have converted, and after day 7 here, we have about 5%, 10% altogether. Next slide. So other measures that we've sort of continued or reintroduced, we still advise to use N95 for all of COVID, rule out COVID patients, all AGMPs. For units on outbreak, presently we have 2 units on outbreak. D9 is an outbreak. We've had transmission from healthcare worker to healthcare worker. If you're in open space, nursing station, and an outbreak unit, please wear your N95. If you're going to be in a high-risk situation, cardiac arrest, an area that's crowded, poorly ventilated, please use an N95. We felt we have to go back on meetings a little bit, as unfortunately we saw some meeting where people were eating, not respecting distancing. We haven't reached the peak of the 6th wave, and so we have reinstituted the advice to have virtual meetings as much as possible throughout this 6th wave. If essential, obviously you can have it in person. Try to limit the number of persons, the 2 meters and the mask, and respect the room capacity for a few more weeks. Next slide. I remind you, change your mask frequently if wet, soil damage. If you use it continuously, make sure you change it every 2 to 3 hours. Hand hygiene every time you touch your mask, and change your mask after you've seen a patient who is COVID confirmed. Next slide. Maybe the relatively good news at the MUHC is this slide, which is the number of healthcare of nosocomial cases we've had. As you can see, we've had about a dozen cases in the 6th wave. To note, we've had a couple of cases at the children. To note, we've had more cases at the Glen nosocomial than the general. maybe things are not that bad because of what everything we're doing still at the MUHC. We've had a policy to preferentially admit patients at the Glen instead of the MGH. And I think that has served us well. Next slide. As I mentioned, we have 2 outbreaks currently, one on D9 with 4 cases. Glen Radiology, this is an outbreak in admin staff where 5 of them caught COVID, and we have a peer alert at Lachine at Camille Lefebvre with 1 clear nosocomial case in the patients, but touch wood for now, only 1. Next slide. Outside Montreal, this is the list of all the hospitals who have outbreaks in our region. So you can see that things have picked up elsewhere as well. All of this in the last 2 weeks. A number of acute care hospitals, a number of CHSLD. In addition, not shown on this table, there are 35 résidences pour personnes âgées and 6 ressources intermédiaires. So the recrudescence is unfortunately happening everywhere. Next slide. So as you've noticed, there's been a major shift in the ministry's approach to controlling COVID. We've shifted from collectively imposed measures to really a model of individual responsibility to prevent transmission. You may debate whether that's right or wrong, but that's the way we're going. And I maybe have only one question for us, which is, you know, as a healthcare worker, do we have any additional responsibility to our patients or colleagues? It's a question. My own advice, I know we're all tired. I think we just may have to make a little additional effort to limit our contacts to the peak of the 6th wave. If we look at what's happening in Europe, it hasn't gone as high in most countries and it's starting to go down. So I think a few more weeks, we should get through this, especially with the nice weather coming with the spring. If you have symptoms, whether it's COVID or something else, please do not come to work. We're starting to see a little bit more influenza in the province. And I think we'll have to keep our mask in hospitals a little bit longer than in the community. And final slide. Quite a few things have changed in the last 3 months. And certainly we have a lot of threats to our homeland. And COVID is really only one of them to put in perspective. And I will stop here. Thank you.
Merci, Dr. Frenette. On va passer la parole à Madame Caroline Dubé. She's going to be telling us about our policies on return after being tested and also on premiums. Caroline, c'est à vous.
Oui, alors pour le retour au travail, Dr. Frenette a déjà fait un excellent travail. J'ai absolument rien à ajouter. Merci beaucoup, Charles. Pour ce qui est des primes, est-ce que tu peux changer, Kelly, s'il te plaît? Merci beaucoup. Pour ce qui est des primes, tu peux aller à la prochaine, s'il te plaît. Merci. Alors, il n'y a rien qui change. Je vais y aller de façon très, très simple. Vous aviez entendu parler, puis même dans certaines communications qu'on avait fait, qu'il y avait une fin des primes au mois d'avril. C'est ce qui avait été énoncé. Mais finalement, compte tenu de la situation, les primes que vous receviez et que vous recevez toujours vous les recevrez jusqu'au 14 mai, qui est la date qu'on a reçue pour le moment. Alors, on parle de la prime 4,8 les primes de 1 000 $, ce qu'on appelle les primes escaliers lorsque vous travaillez et que vous êtes là pour plusieurs semaines, là, qui s'accumulent au fil des semaines. La rémunération en taux double lorsque vous effectuez du temps supplémentaire, en plus de l'accumulation de la demi-journée de vacances. Le forfaitaire de 100 $ pour les temps partiels qui effectuent plus de 30 heures. Remboursement de frais de taxi, remboursement de repas ou le 15 $ sur les quarts de travail faits en temps supplémentaire et remboursement d'autres frais. Prochaine diapo, s'il te plaît, Kelly. Merci beaucoup. Qui seront maintenus selon ce qu'on sait après le 14 mai. Vous avez d'abord le forfaitaire allant de 12 000 à 18 000 $. Donc, si vous avez décidé de rehausser à temps complet ou que vous êtes à temps complet, cette mesure demeure. C'est des contrats qui devaient être signés. Donc, ça, il n'y a pas de problème. On parle aussi de forfaitaire en région éloignée. Je vais moins prendre de temps par rapport à cet aspect-là. L'embauche de personnes salariées temporaires via la plateforme Je contribue. Nous avons de telles embauches au CUSM. Vous pouvez avoir des collègues de travail ou vous-même qui êtes concernés. Alors, cette mesure est maintenue après le 14 mai. La possibilité de monnayer vos vacances. La possibilité de déplacement volontaire, je dis bien volontaire, de personnes salariées entre les établissements et à l'intérieur de notre propre établissement. Et évidemment, l'obligation d'être protégé pour l'application des primes. Alors, ce qu'on dit d'une autre façon ici, c'est pour les gens qui ne sont pas vaccinés, doivent continuer à aller se faire tester selon l'arrêté ministériel et selon ce qu'ils connaissent depuis plusieurs semaines. Prochaine diapo, s'il te plaît, Kelly. Mesures qui seront maintenues en fonction de l'évolution de la situation épidémiologique. Alors, on parle de la prime de 200 $ pour l'ajout d'un quart de fin de semaine, la prime de 2 000 $ pour les gens qui sont de jour et qui veulent aller travailler de soir ou de nuit pour une certaine période. La prime de référencement, si vous nous référez quelqu'un qui veut travailler pour nous pendant une certaine période de temps, alors cette prime-là demeure. Et le remboursement de frais de permis d'exercice lorsqu'applicable, ce n'est pas évidemment pour l'ensemble du personnel, c'est des situations extrêmement spécifiques et les personnes à qui ça s'applique sont au courant. Et finalement, les personnes salariées qui voulaient se prévaloir, là, entre autres, du 12 et 18 000 $ avaient jusqu'au 31 mars pour en faire la demande. Déjà, ce délai-là avait été prolongé à l'automne dernier, avait été prolongé finalement jusqu'au 31 mars et maintenant, la période est close. Alors, c'est tout pour moi, si je me souviens bien. Est-ce qu'il y a une autre diapo, Kelly? Ça va pour moi. Merci beaucoup.
Kelly, on peut maintenant retirer le partage d'écran, s'il vous plaît, et on va commencer la période des questions. Alors, je vais inviter les panélistes à ouvrir leur caméra. Kelly, can you please remove your sharing of the screen? Thank you very much. Alors, bienvenue à une nouvelle période de questions. Vous êtes nombreux aujourd'hui, plus de 900 personnes sont branchées à ce webinaire. Merci de continuer à participer. Nous avons quelques questions. Rachel, pour la première question.
Est-ce que nos patients immunocompromis doivent encore s'isoler pour 21 jours à la suite de leur test positif?
Dr. Frenette?
Oui, c'est encore le cas.
Merci.
Are the fast spreadings by new mutations, are they the effect of non-vaccinated people?
The thought is that the more people you have infected with the virus, the more the chance of mutations. So as I showed you the hospitalizations, it was 50-50. But I think it's been shown that usually people who are not vaccinated tend to have higher viral load for longer periods of time. So they're more predisposed to having mutations.
Merci, Dr. Frenette. Rachel, avant de passer à une prochaine question, je voudrais inviter les gens à inscrire leurs questions dans le Q&A. So if you'd like us to read your question and get an answer, please enter them in the Q&A. I see that some attendees have raised their hands, but we're going with the Q&A question. Thank you very much. Rachel, next question.
So what is the point of getting all 3 vaccine doses if you end up getting COVID anyway?
So that's a good question. So if it hasn't been clear to everyone, the major focus right now is preventing hospitalizations and mortality. Okay, you know, pretty much all of society, we've not given up, but there's so much we can do to prevent infection. It's what we want to prevent is severe infections. So if you've had 3 doses, you have a higher chance of being not very symptomatic, that it will be a very short duration, and that you will be less contagious.
Dr. Frenette, it's such an important question. Est-ce que vous accepteriez de répondre aussi en français, s'il vous plaît?
Oui, alors il faut comprendre que le focus à l'actuel au niveau sociétal, ce n'est pas de transmettre, de freiner complètement la transmission, mais de prévenir les complications sévères de la maladie, c'est-à-dire les hospitalisations, les soins intensifs et la mortalité. Et c'est là que la vaccination fait une grosse différence. Je vous ai montré encore les diapos, là, il y a peut-être à peine moins de 10% des gens qui ne sont pas adéquatement vaccinés, mais ils représentent encore 40-50% des hospitalisations. Alors, le fait que vous êtes vacciné, 3 fois, ça prévient des maladies sévères.
Merci, Dr. Frenette. Rachel, prochaine question, s'il vous plaît.
Are there any plans to provide a 4th vaccine for all healthcare workers then?
Well, if you're an immunocompromised healthcare worker, you should get your 4th dose. But for now, there's no ministry guidelines to vaccinate healthcare workers as of yet.
Thank you, Dr. Frenette. Rachel.
Okay, I have a long one here. For an exposed healthcare worker with continuous family contact, i.e. a child from whom you can't isolate, the slide said to come back after day 8, after last contact. But if a continuous contact, how do we determine the last contact? Is it from the day the child tested positive? What if multiple people test positive within the family over a few days? Is it from the day the last person tested positive?
So yeah, it's a long question, and I'm afraid that the slide is slightly wrong. So it's day 8 from the initial contact, which is the slide I showed you. And what happens basically, why did this change? And it was a major change. We figured that by the time your spouse or your kid is diagnosed, you've already been exposed for 1, 2, 3, 4, maybe 5 days. So the exposure has occurred. And if you were to be contaminated, it has happened by the time we have the diagnosis of your kid or your spouse. So it's not from the last contact. I'll have to change that slide. It's from the day of the initial symptoms diagnosis of your familial case.
Merci, Dr. Frenette. Je voyais que Dr. Rubin voulait peut-être ajouter quelque chose.
Yeah, so there will be a new operational bulletin summarizing everything, and it's in there that is the definition of first day, last day. It will be there. And the second part of the question was if you have multiple people in the family who are getting exposed. I think Charles said it, but basically we don't restart the clock.
Thank you, Dr. Rubin. It's quite complicated and there's multiple nuances in there. So the managers are invited to work with the PCE experts and the Occupation Health and Safety team to make sure that we are following this well. And as Dr. Rubin mentioned, there is a simplified memo that would be that have been prepared and that will be issued today or tomorrow to help the MUHC community. Thank you very much, Dr. Frenette, Dr. Rubin. Next question, Rachel.
Thought I'd follow up with a related question. If my child has been exposed to a positive teacher but has no symptoms and had a negative antigen test, should I be bringing her to get a PCR test and one for me too?
Dr. Rubin?
Yeah, so at this point in time, the indication to test somebody within the family is if the family member is symptomatic. I think everybody is being exposed, whether it's a teacher, a friend, a colleague, and we're not recommending routine testing there. And certainly it wouldn't even then extend to the healthcare worker. It's based on symptoms.
Merci, Dr. Rubin. Patricia, en termes d'offre de service du CDD, est-ce qu'il y a des précisions à apporter? Maybe in English, as the question was in English.
No, we've kept the current staff. We want to make sure we are contacting the clinics to make sure that patients understand that they don't have to come between 8 and 10. This has been changed in the last few months, and we're still telling them to come between 8 and 10. So it's creating a lot of people between 8 and 10, but we have the capacity to do that. So we just need to make sure we communicate to patients that they can actually come anytime. There are no delays at the time to get the results by the following day, and they could come after 10 where there's less people. So we've been updating all the intranet, the website, communicating as much as possible, and that's going to be key to make sure that we can manage the workload. But the staff is there and available.
Merci, Patricia. Rachel, next question.
Are there any vaccines in development that could be more effective in blocking transmission, or are we stuck with endless waves?
Well, I know that, for example, Pfizer was working on a more Omicron type of vaccine, but I think the change of the virus is faster than, you know, the time it takes to study a given virus. You know, hopefully with being exposed to so many different strains at one point in time, we will earn collective immunity. You know, when you think of it, you know, it's overall for society, it is very contagious. So it is infecting a lot of people. So a lot of people are getting natural immunity. And thank God it's not as severe as, you know, the first 3 variants. So hopefully we'll get out of this for a while anyways.
Merci, Dr. Frenette. Rachel. Oh, Dr. Feller, vous vouliez intervenir?
Yeah, I just wanted to say that historically pandemics have ended even before the era of antibiotics and vaccines and antiviral agents. For example, the Spanish flu, 1917, 1919, it ended by itself. And it's been the case in the past with other pandemics. So let's keep hope and il faut avoir confiance. J'espère qu'on va s'en sortir bientôt.
Comme vous avez dit, il faut continuer à mettre l'épaule à la roue puis rester patient. Ça va s'atténuer. Merci. Rachel, prochaine question.
If viral load peaks at day 4 or 5 with BA2, will this change how long before symptoms develop, or you're considered infectious?
Well, clearly if it peaks at 4 or 5, maybe you're more infectious at day 4 and 5, which is different from the previous variants, at least, you know, the alpha, beta, and delta. But yes, but the other end of the course is, you know, you might still be infectious at day 6 and day 7. And that's why, you know, we try to keep the quarantine up to day 7. And as shown by our data, you know, and bringing in new tools, which is this antigenic test, which correlates with viral load, to try and bring back people earlier. But I remind something that's very important. It's as long as your symptoms have resolved. So if you still have fever day 7, you know, and cough and myalgias and headache, you know, you're not eligible to the antigenic test. So that's very, very important.
Merci, Dr.
And the other thing I have to tell you is we're dealing this quarantine rules and return to work rules are only considering the contagious part of the disease, but like if you've had, si vous avez eu une grippe d'homme puis que vous n'êtes pas rétabli au jour 7, ben, faut prendre le temps que ça prend pour vous rétablir.
Merci, Dr. Frenette. Les pauses que vous faites entre vos phrases me surprennent. Désolée de vous avoir interrompu. Dr. Rubin.
Yeah, just to supplement the answer to the question, what we're seeing differently with Omicron versus the previous variant is a predilection for the upper respiratory tract. And so a lot of people will have that scratchy throat that's, do I have, don't I have? People are kind of disregarding that scratchy throat maybe, and then the next day a little bit of congestion. It looks like a regular cold. As spring is coming, seasonal allergies may also mimic it. So what we really are seeing in retrospect is that the time period to develop symptoms is still quite short, even with what we think is predominantly BA2. Sometimes starting 2 or 3 days, but with very mild symptoms. So just to be on the alert for that.
Thank you, Dr. Rubin. Mais quand on a des symptômes, même s'ils ne sont pas de la COVID, si c'est un virus qu'on a, on n'est pas censé travailler avec des symptômes de toute façon, n'est-ce pas? Il faut rester à la maison quand même si nos tests COVID sont négatifs. Il ne faut pas oublier ça.
Exact.
Merci beaucoup. Rachel.
You recommend we avoid going to concerts or other events, such as sporting events, even if we keep our masks on.
So, this is where, use your judgment, if you go to an event where everyone is wearing their mask, where there's not too much singing, yelling, where there may be a lot of space between seats or tables, right now, I think, choose wisely the events you're going to go to, and maybe wait a week or two before, going to a rock concert at the Bell Center.
Merci, Dr. Frenette. Dr. Rubin?
Yeah, I was going to say my sister-in-law went to Justin Bieber, and she told me that 95% of people were wearing masks on their arm, underneath their chin, on top of their head. But the percentage of people covering their face was very, very small. So I think you need not only to look at the work environment where you want to protect your colleagues, but also the people within your own home environment. If you're looking after elderly parents or anybody who's susceptible, and to use your judgment, it's not the time, in my opinion, to do it as this wave is going up.
Thank you, Dr. Rubin. And I expect at Justin Bieber's concert, there's a lot of singing and yelling. I think it fully qualifies.
The one last thing that's coming up is Easter, Easter Mass, Passover, and large family gatherings. And again, to use judgment in terms of where you're going and who you're going to be exposing afterwards.
Thank you, Dr. Rubin. Rachel?
Should workers in open office settings wear masks, and how long does a virus stay in the air of a room?
So the first question is easy. Yes, if you're in an open office area without physical barriers, you should still be wearing your mask at the MUHC. And then how long does the virus stay in the air of the room? Well, that depends of the air exchanges in the room. Are your windows open? How big is your room, etc. We're quite fortunate at the Glen new hospital. Pretty much all the hospital is well ventilated. Patient rooms have 6 air exchanges. So, this has been, it's been an area where that's why we favor admitting here rather than the other hospitals. Unfortunately, some of our older sites have less than ideal ventilation.
Merci, Dr. Frenette. Je vais en profiter pour inviter Dr. Sidorovitch et peut-être Alain Biron de nous parler combien l'hôpital est occupé et qu'on a des défis si on a plusieurs travailleurs de la santé qui sont retirés. On a des défis à réaliser notre mission. On a peut-être Dr. Sidorovitch et puis Alain, qui est avec nous pour la première fois depuis sa nomination comme directeur des soins infirmiers. Alors, je l'accueille officiellement. Eva?
Oui, alors bon après-midi à tout le monde. Hello, everybody. Yeah, just actually while we're having this meeting, I'm trying to struggle to find an ICU bed for a patient at Lachine right now. The network is, there are no beds anywhere in Montreal right now. So the network is incredibly full. The MUHC is overflowing with patients in its emergency rooms. So just to kind of bounce off the message that I've been hearing, just pour faire un peu de millage sur le message, c'est que je pense qu'on est dans une situation où là, on a resserré à l'intérieur de nos murs un peu nos activités pour éviter justement que la propagation du virus se fasse à l'intérieur de nos murs entre tous les travailleurs de la santé. So we're being very careful about meetings inside. But I also think that there needs to be a little bit of judgment exerted, even if the regulations say that we can do things as a society. But I think that given this the tenuous situation right now with the sixth wave that is starting to increase, the fact that we've lost a lot of healthcare workers right now, and yes, the rules will be a little bit easier to bring people back, but we're in a bit of a delicate situation for the next week or two. And I think for the sake of our patients, we probably should be a little bit more careful with our activities and ensure that we break this wave and that we can kind of then go into the spring and hopefully the summer in a much more comfortable position. So that's kind of my message this morning. It really is a struggle. And again, I'm on call today, and just while I'm listening to all of you speak, I'm trying to deal with non-existent beds in the MUHC, but also outside of the MUHC. Very worrisome.
Merci Eva, le message est très clair. Merci Alain. Est-ce qu'il y a quelque chose que tu voulais ajouter? Il y a beaucoup de travail qui a été fait dans les derniers jours pour identifier du personnel pour remplacer ceux qui sont retirés.
Donc, ce serait peut-être plus au niveau du processus là, pour spécifier que les nouvelles directives qui ont été présentées par le Dr. Frenette il y a quelques minutes. Donc, OHS est encore impliqué dans le processus, for flou. OK? Mais par contre, ça devient un rôle du gestionnaire aussi d'assurer un certain suivi au niveau de qui peut revenir ou pas et le suivi au niveau des résultats des tests qui ont été faits. OK? Donc, peut-être spécifier cet élément-là là, qui n'a pas été présenté explicitement.
Merci, Alain. Dr. Feller?
Oui, je voulais dire, c'est pour ça que la semaine dernière, on a émis un communiqué dans lequel on demandait de mettre fin à toutes les activités en présentiel, les activités qui n'étaient pas absolument nécessaires. We felt that for a couple of weeks, we should be stricter on these guidelines, like meetings in person that are not really absolutely necessary. For the next 2 weeks, we should avoid them because of the high number of healthcare workers who are at home and not able to work at the present moment.
Merci, Dr. Feller, en effet. Et on vous invite à continuer à surveiller les mémos qui vont être émis, puisque comme la situation évolue rapidement, le CCMU a recommencé à avoir des rencontres plus régulières et émettra les communiqués en lien avec les décisions qui seront prises. So we invite you to continue to watch the incoming emails. We have many questions, and it's 7 to 1. We'll continue to answer a few questions, but we'll make sure that the additional questions that we haven't answered, we'll find a way to get the answers out to you through the internet. Rachel, one next question, please.
What is the protocol that we need to follow when rebooking patients in ambulatory care that are COVID positive? Do we wait 10 days after infection to book these patients?
Good question, Dr. Rubin.
Yeah, we don't want people who are potentially infectious coming into the hospital environment because of the susceptible other patients who are around them. So if it's something essential, then there has to be the accommodation to bring them directly into their own room. If it can be delayed until 10 days after their onset of symptoms, that would be preferable because we need to protect the overall patients who they will be in contact with.
Thank you, Dr. Rubin. Next question, Rachel.
I think this is important. Who will call the employee in quarantine that could come back as per the new criteria? I think that Alain said it in French, but maybe we need to say it in English as well.
Yeah, thank you. Alain, est-ce que tu veux parler? Ou Caroline, peut-être?
Caroline. So,
Vous allez recevoir les directives soit par le 4-4 Flu ou par le gestionnaire. Donc, c'est vraiment un suivi qui se fait en collaboration.
Je pense, Alain, que tu avais l'intention de réunir surtout les gestionnaires cliniques là, pour clarifier le processus, n'est-ce pas?
ben, les directives ont été mises. We are going to switch to English, but we will have some directives and explain a bit more the process, okay, based on those new directives coming up. Okay, but it's a collaboration, as Karen said, between OHS that starts the process, and then that after that, that's the managers that take on the rest.
I expect the managers will continue to have a number of questions and we'll follow up on it. We understand that there were many changes implemented on Friday. We tried not to do that, but the instruction came from the ministry late on Thursday. So we had to work fast at the end of last week to support the difficulties we were going to face during the weekend. Alors, il y a des nouvelles directives qui sont arrivées jeudi en fin d'après-midi. On les a implantées vendredi, ce qu'on a essayé de ne pas faire pendant la pandémie, mais on va continuer à raffiner le message et à répondre à vos questions. Rachel, une prochaine question, s'il vous plaît.
If a rapid test is positive, do we have to get a PCR confirmation at this point?
So for new COVID, certainly at the MUHC, we prefer to have a confirmation. We've had a few cases where people have had had positive antigen tests at home and negative PCR here, and twice. So those people, you know, home tests are okay, but we always prefer to have a confirmation with a PCR test.
Merci, Dr. Frenette. Rich?
According to the CIQ recommendations, anyone over 18 in Quebec who wants a second booster, i.e. a fourth dose, can walk in and get one. Is that correct?
That was not my understanding. Certainly immunocompromised host, and I think I can't remember if it's people over 70 or over a certain age. Maybe Patricia, you can, what's the age break for the second booster?
It's people over 80, immunocompromised people. This says that if you are over 12 and you want a fourth dose, and there is, you can go without an appointment for some of the centers who are actually providing it without appointment. I have checked this weekend. There's none in Montreal at this time. And you will need to have informed consent because it is not a recommendation, but is a possibility. And it's based on vaccine availability. If you try to book this on Click Santé, you won't be able to do it. They will check your age and your last date, and you won't be authorized to book it on Click Santé. So the SIC was really clear that it is not the groupe prioritaire at this time. It is not recommended. But with informed consent, it is possible.
Alors, les gens immunocompromis et les personnes de plus de 80 ans.
Pour le moment, oui. Et il n'y a pas pour le moment non plus pas les travailleurs de la santé comme avait été mentionné au début de la rencontre.
Merci, Patricia. One last question, Rachel, please.
Can we receive comments on the latest variant in terms of its resulting in long-lasting symptoms?
C'est tôt encore, hein?
Yeah, no data yet for long COVID. You know, BA1, it's only been 4 months. So
from a pediatric perspective, what we are seeing is less of the post-COVID inflammatory syndrome called MISC or PIMS. It doesn't mean that it's impossible, but we're not seeing as many admissions as we had seen with previous variants.
So less severe disease, we'll have to wait to see if there's the long COVID associated with BA2. Alors, merci beaucoup d'avoir été présent. Again, there were many of you today and a large number of questions. Thank you for your participation. We will follow up on the questions we haven't had the chance to answer. Thank you very much to the panelists, Rachel and Kelly. Thank you for your help and support. Good afternoon, everyone. We'll be in touch. Stay safe. Prenez soin de vous.